So originally, I was born in Pakistan in Kashmir, and when I was around 11 years of age, my parents decided to move to England, and their main purpose was for education for myself and my brothers and sister. And from that very young age, my parents wanted me to become a doctor because they wanted a doctor in the family. And so when I was at school, it was in my head that I was going to become a doctor. So all the studying, O levels and then A levels later on, were geared towards getting into medicine. And so when I'd done my A levels in Yorkshire, I applied and eventually managed to get into medicine at Manchester University Medical School. So that's how I got into medicine. So I'm a consultant paediatric cardiologist here in Evelina London Children's Hospital in London. That is specialising in babies and children with congenital heart defects and their treatment of. So there's obviously many cases like that, because one of the problems in developing countries is that because the babies and children have not been treated, they present very late with their heart problems. And when they present late, there are many more complications related to their heart defect. So that becomes a very difficult challenge for us to deal with. There was one particular example in Ethiopia where a 7 or 8 year old child came with massive collection of fluid in his tummy, which was related to the right side of the heart failing because of a severe heart defect. And the only way that child could survive was if we could correct and relieve the obstruction of the valve, allowing blood to go to the lungs. So that was a challenging one, and we did that on one of the missions, and within about 4 to 6 weeks, because the heart improved in its function, the fluid gradually disappeared in that because the heart was pumping more efficiently, started passing more urine, and he lost a lot of weight, which was purely fluid collection. And he was, within less than 3 months, he was a completely different child, and that is one of the best examples of treating somebody very late and then making a huge difference to their lifestyle. Another example was a child who came in a similar way, who really couldn't walk, who was very blue, and her aunt brought her out from Yemen to one of the missions in Jordan, where the child was treated surgically, and within days of that mission she was able to walk around a lot better without loss of oxygen, without becoming blue, and suddenly started improving. And on a subsequent mission, when we saw that child again, she was really completely a different character, unrecognizable from the one who couldn't walk and who was completely blue. So these are just a few of the examples of children where we make a huge difference to children who have developed complications as part of their heart defect. If at the moment in the UK there is quite a big shortage of doctors, both in general medicine but also in different specialties. And so if there are potential candidates who want to do medicine, it really would be a great specialty to get into in medicine. And then there are plenty of choices in subspecialties that you can train in and really be satisfied with the career and the lifestyle, and be absolutely thrilled that you're making a huge difference to patients in the UK. And ultimately, if you get into charity work as well, then you could make a huge difference to patients in developing countries or completely underdeveloped countries. So this is the sort of opportunity that really needs to be considered seriously if you're keen. It does mean that you have to work really hard during the training in order to become good. So rather than training to be average, really you should train to top of the profession, top of the specialty, and then you can make a huge difference to humanity around the world. And charity work, there are many charities that do different types of charity work that make a huge difference. And so that will be the other satisfying part of the job, that where you're going on missions to treat both children and adults with different types of problems, not just heart defects but other problems as well. And remember, when you see those patients the next time around, they will tell you how much of a huge difference you might have made to their life and to the life of the parents. So Physicians Across Continents is an important charity. As I mentioned before, there are many charities doing different areas of work across the world. Physicians Across Continents also deal with conditions where surgery and different types of treatment are required in different parts of the world. So that is an important task that makes a huge difference to those patients in those countries. They also run mental health clinics, and again, that's an important part. It's become more obvious in the last few years how important impact that will have on patients and families, and so those mental health clinics are important. You can, if you check with any charity, Physicians Across Continents is another one where volunteers, we rely on volunteers both in medical, nursing, and different areas, and so the volunteers take their own time off. They get their own leave at their own and travel at their own expense, and those are areas where charities really do rely on these volunteers to help, and that's an important task. So if you're willing to be a volunteer, if you're willing to be part of a team that travels across and treats patients in different parts of the world, then really it's I need not emphasize how important it is for you to volunteer with charities such as Physicians Across Continents. In order to be able to treat any patients, whether they're children, whether they're adults, whatever types of heart defects or whatever types of other general defects like cataracts or chest illnesses, abdominal illnesses, anything, the charities that take part in dealing with these issues around the world rely really solely on charity donations from the general public. And so it is very important to donate to these charities like Physicians Across Continents, because those donations go a long way towards making a huge difference and a huge impact on the life of the patients and their families. So really cannot emphasize enough about the charity donations.